From abdominal pain to nausea and a wide array of gastrointestinal conditions, Memorial Hermann Medical Group has easily accessible clinics across Houston with board-certified physicians dedicated to treating GI disorders. Here with more on what a GI doctor does, why you may be referred to one, and what kind of treatment options they offer are gastroenterologist Dr. Vinitha Bala and Dr. Prasun Shah. Welcome to you both. And first of all, let's just get into what gastroenterologists actually do. What types of things do you help people with?
Okay, so gastroenterologists traditionally used to just diagnose the gut health related issues. But since the advancement of the technology, advancement in knowledge of biology, the role has changed, and it is not just the diagnostic purposes, it is a treatment. We can be a geneticist, we can be a palliative care provider, we can be chemotherapists, a lot of other stuff which a gastroenterologist can perform nowadays with a lot of advancement and help with technology, yes.
And I know we often hear about stomach problems, but GI issues, they can really be affected by the intestines, colon, liver, pancreas, gallbladder. So walk us through some of the signs and symptoms that people really need to keep tabs on.
Patients, most commonly when they can't see the rectal bleeding, they always think it's hemorrhoids, because whenever there is rectal bleeding, there are various reasons, but most importantly, it's colon cancer. But most of the times, patients think that's hemorrhoids, and have over and over seen patients that had bleeding for a long time. They presume it's hemorrhoids, and finally, when they come to see us, we diagnose them with colon cancer, which is very preventable. So not all bleedings are not hemorrhoids. Not all abdominal pain is not irritable bowel syndrome. Not all diarrhea is just infection. So there are certain concerning symptoms when it goes on for a certain period of time. It's good to see a gastroenterologist to get a comprehensive GI care where we can perform certain tests and procedures and get to the root cause of the problem than too late.
And the things that you're both describing, I mean, these are quality of life issues, clearly. In some cases, you're able to save someone's life by diagnosing a disease early on. Let's talk a little bit about your messaging to people who have maybe been experiencing symptoms and have been putting off going in to see a doctor. What is your message to them?
So many factors play actually role in a healthy digestive system. My message would be that don't take any symptoms in a lightly. Symptoms as much as like abdominal discomfort. It can be pain, it can be bloating, it can be upset stomach, it can be diarrhea or vomiting, it can be bleeding, or it can be constipation. All those things, even though how minor it seems to you, might be meaning to a larger problem. So any of the symptoms which I just mentioned, or any of the other issues like a weight gain or weight loss or loss of appetite, all those things should lead you to the concern and seek the advice from a gastroenterologist.
Yeah, do not delay. Seek treatment right away. We've got about a minute left. I know there's a new GI clinic in the Woodlands opening mid to late September, depending on construction. But talk to us about the importance of having a clinic that is completely dedicated to treating GI disorders.
So the benefit of having a clinic, the patients have the opportunity to see a gastroenterologist and interact with them, or specialists treating the digestive health, and they can really come up with the plan very effectively and in a timely manner. We also provide a comprehensive care where we provide patients with the screening, colonoscopies, where we educate them and also practice a preventive care. So it's very important, this clinic which setup is coming up, which provides a comprehensive GI care with multiple procedures and also screening, colonoscopies. And we have a very wonderful staff who are very efficient, and they can schedule your appointment as soon as possible to seek care.
That is right. An ounce of prevention is worth a pound of cure. Doctors Vinitha Bala and Dr. Prasun Shah, thank you so much for your time and advice.
Thank you, Derek.
Thank you for having us.
And if you would like more information, you can visit mhmg.memorialhermann.org or you can call 713-222-2273.